Disease management in the U.S. started as treating the symptoms of the disease, not the prevention of disease. As in the case of diabetes, after diagnosis, physicians have patients monitor glucose levels. They change the person's diet and exercise regimens to reflect the onset of this disease. Currently, the physicians deal with chronic disease is to focus on prevention. Family history, along with earlier testing, allows physicians to either stave off disease altogether, hold off the occurrence of disease, or lessen the impact on one's overall health. By having earlier testing, physicians can start people on making positive lifestyle changes. This includes a healthy diet, physical activity, and knowledge about the potential disease. Disease management in Canada has been along the same path as the United States process. Starting as treating symptoms has become involving patients in their care. The process of involvement includes healthier behavior choices, leading to improved quality of life. Disease management in Mexico has followed a similar path as the US and Canada. Studies have shown that self-management of one's care leads to more successful outcomes, better diet choices, and physical activity. But physicians in Mexico also discovered that men at risk of chronic disease did not involve themselves at the same level as women in self-managing their disease. Physicians then took a family involvement approach to offset men's choice to opt out of self-care programs. Studies put in place were delayed because of the health problems not related to a current study or non-participation after studies were initiated. This thwarts Mexico's ability to provide positive patient care. Patient participation in the U.S. is advocated by health professionals. Patients involved in their care respond better to treatment. In past years, patients were told what to do and expected to do so. Their role as a patient was a docile one. That is no longer the case. Patients have better outcomes when they have a say in their care. Canadian medical goals are the same. Physicians want their patients engaged in their health decisions. Most interactions for patient involvement involve the patient-physician relationship. This is, of course, the one most expected, but other healthcare professionals should also engage the patient for a circle of care that can ensure patient participation. This includes family and friends, and patients' relationships within these circles are found to enrich a patient's life and help them to seek and acquire positive outcomes for their healthcare needs. In Mexico, diabetes is ranked as the leading reason for death and disabling people from their option of a healthy life. Mexico, unfortunately, is behind in their goals to address this chronic disease. While many physicians recognize the seriousness of the disease, along with the current state of addressing diabetes as a nation, there is more to do. Mexico's slow to reaction seems to be buried in initiatives that have not fully gotten off the ground, along with tracking information that either hasn't prompted change or the reporting of findings is not reaching those who need the information to affect change. Mexico has been slow to react to the changes that have occurred in population health. Mexico has recognized the need for better and more extensive healthcare coverage with their own universal health coverage plans. The programs have been complicated, leaving many without the knowledge that they may actually be covered, therefore do not seek treatments. That, coupled with high out-of-pocket costs, leave many uninsured, uncovered, and unwilling to seek care. In both Canada and the U.S., healthcare coverage is found to be very similar. Both countries have excellent medical personnel and treatment options. Both countries have large amounts of money spent on healthcare, not only from the citizens in each country, but in government and other supplemental programs. While there are differences such as longer wait times in Canada for elective surgeries than in the U.S., the quality of care for emergency care is competitive with the U.S. And while many still lack coverage because of their socioeconomic status here in the U.S., Canada's universal health care covers all citizens. Both countries are forward-thinking in policy, care, options, etc., and no one system is better overall than the other. This is seen and noted by the recognition of physicians, as an example, who have been known to cross the border to enhance their practices, techniques, and such, keeping both the U.S. and Canada on an even playing field when it comes to the care patients can expect. Policy between the two countries are very similar and forward moving to address the latest health concerns positively. Ranking both the US and Canada as either first or second is not easy. They are both highly ranked, and depending on any specific area to evaluate, one may rank higher than the other at any given point in policy, treatment, or positive outcomes generally. Mexico, on the other hand, is ranked the lowest of the three countries, with greater improvements needed in almost all areas pertaining to the public health. Mexico could benefit from what the US and Canada has learned and implemented. While not perfect, the success of these two countries is evident. Looking at ways that the US can improve in delivery of patient care starts with the ability to integrate the systems in place to be more effective. An example would be the electronic health record system, EHR. This system is very effective when patients return to the same physician and hospital for treatments. But if they are, for example, on vacation and must seek care, the new medical facility has no way to see a patient's history to determine best care. This can cause a delay in treatment. If the patient were to own their electronic health record, then the information would be readily at hand. Collaboration among healthcare professionals and teams that provide health care, along with patients, their family and friends, would go a long way in resolving issues of care and providing positive conflict resolutions in that care. Putting what one could describe as ego aside, much more could be accomplished and in a much more timely manner when a collaboration is the goal. Aligning goals amongst healthcare teams and the overall mission of healthcare would see greater positive outcomes for patients. This, again, would facilitate care to meet this goal, setting aside professional goals not related to specific patient needs. In conclusion, recognizing that there are a myriad of goals, policies, personalities, and illnesses affecting the world's populations, there are no easy answers or resolutions. No one system is best, but all can benefit from ideas for positive change and outcomes. One constant in all aspects of healthcare is patient involvement. The more patients that willingly choose to have a say in their own health and care, the more positive outcomes healthcare providers will see. Two benefits of this are easily concluded: healthier people and lower healthcare costs. Cost, though, is for another discussion at another time.